We're going to continue our coverage of American Heart Month, and we are looking specifically at a heart valve condition that is called aortic stenosis. This is a condition that's often overlooked, we're told, but there could be a little less invasive treatment option for some patients. So to discuss, we are speaking tonight with Dr. Anita Kruger. She is right here. Thank you for being here, by the way, Doc.
Thank you so much for having me.
We appreciate it. She's a cardiothoracic surgeon, by the way, Baylor Scott White. So let's start with the definition, right? If you've been diagnosed, maybe you know what it is, because hopefully your doctor told you about this. Aortic stenosis, what is it and why is it often serious if it's left untreated?
Yeah, absolutely. So, aortic stenosis is one of the most common heart valve problems that we can have. The heart has 4 valves, but the aortic valve is really, it's like the one-way check valve at the last point at which the blood leaves the heart to go feed the rest of the body. And so if that valve is thickened, gets calcium buildup on it over time, people can start to have some symptoms like shortness of breath, chest pain, even passing out sometimes. And so the heart can tend to get tired of trying to push against that valve that's not opening very well, and that's what leads to problems.
Yeah. So some people think heart disease, like automatically. I remember when my mom had an issue years and years ago. She, oh my gosh, I'm going to have surgery, But it's not necessarily always surgery, not always true, of course. Tell us about the less invasive alternatives nowadays.
Yeah, the good news is that in this space, technology is advancing so rapidly. And so we have a lot of things that don't involve opening the chest. And one of the most common procedures that we do is something called TAVR, or transcatheter aortic valve replacement.
TAVR, TAVR?
TAVR, yes,
okay.
Sir. And so that's been around. It's actually not very new. We've been doing it, there's thousands done every year. We've been doing it since 2002. But as I said, the technology is just going like gangbusters. And so basically we go through a tiny poke incision in the groin most times, and we're able to put the valve in that way, which is nice for recovery.
Okay, when you look at recovery with TAVR versus what was traditional recovery, what's the difference between the two?
Yeah, so when we're doing a full open heart surgery, usually those patients are in the hospital for like 4 to 7 days on average. TAVR, most of the time patients are going home the next day, if not even the same day in some cases.
Really?
Yeah.
Heart disease tends to, I think in the general mindset, land in the older person category, the higher risk person category. It's not always that way, we know that, but who might be a good candidate for this TAVR and this better and newer approach, even though you say it's not necessarily that new?
Yeah. So, I mean, you're right. You're absolutely right that with age is when we tend to see more valvular disease. So actually up to 10% of patients over the age of 65 can have valve disease, especially that aortic stenosis that we're talking about. But initially, we started doing this procedure only in patients who were too old or frail or too sick for surgery. And now actually we can do it even in patients who are low or intermediate risk for open heart surgery. So people who are younger, if they have aortic stenosis, they can often be a candidate for the TAVR procedure as well. For
anybody who watches this who may have been told or may feel it themselves, a little heart murmur, a little something that I don't think that everything's right, unexplained symptoms, what do you tell that person?
Absolutely, go see your doctor. And I think especially for women, Go Red for Women. It's we're having our annual luncheons and everything this week. Go see your doctor. It's not just like, oh, I must be getting older. I mean, that's really not the case most of the time. A lot of times there is something that's explainable and very, very treatable. But go see your doctor. The test to actually diagnose aortic stenosis is an echocardiogram. It's a non-invasive ultrasound.
That's easy.
Yeah. Easily done. So absolutely go and get checked out. There's a lot that we can do that isn't super scary.
Okay, you heard it right there, Dr. Anita Kruger. Not everything is super scary. And honestly, I think that's what a lot of people would love to hear, right? Yeah. Listen to your body. Talk to your doctor.